This is LBC News.
LBC News Time 6:42. Very good morning to you. In our top stories, well, Boris Johnson says the UK will donate at least 100 million surplus coronavirus jabs over the next year. The US is buying 500 million Pfizer vaccines for lower income countries. G7 leaders are expected to agree to provide a combined 1 billion doses to the world at this weekend's summit in Cornwall. Well, joining me now is Professor Andrew Preston, a reader in the Department of Biology and Biochemistry at the University of Bath. Good morning to you, Professor.
Hi, good morning.
Well, this is clearly a very big commitment, isn't it, from the G7? So what are your hopes then for what that donated rollout will achieve around the world?
It is a very welcome news. But if anything, I think it highlights the magnitude of the task. Boris Johnson said that the G7 should try to pledge together to help vaccinate the world by the end of 2022. So although it's 500 million doses from the US and a further 100-odd million from the UK, if you consider that sort of 5 billion doses are required to achieve that, it shows just how large that task really is. So while this will help, certainly, by the time it's distributed among the number of countries for which it's aimed, well over 100, it still leaves those countries well short of achieving anywhere near the levels of vaccination that we have in the UK, for example.
Quite a few unions actually echoing your sentiment there, saying it's welcome, but of course it's just not enough, according to them as well. In the commitment too, though, Professor, there's a plan to expand vaccine manufacturing in order to achieve that goal. I mean, how crucial for you, given your expertise, is that most nations will be able then to produce their own doses and bottles and so on, and that's needed, isn't it, if another pandemic comes along?
Absolutely. So that's getting much more towards the heart of the problem, is producing manufacturing capacity that is more local. Because clearly still we're seeing vaccine supply as one of the limitations. I think that's probably why the UK is saying, although we're going to give those doses, there's only a few million this year with more next year. And that's probably because, we just don't have the stockpiles. So ramping up manufacturing is going to be absolutely essential to achieving sort of anywhere near the 70% vaccination globally that we think we probably need to even have a chance of bringing this pandemic to an actual close. And as you say, this is the third beta coronavirus that's emerged in the human population over the last 20 years. This is going to happen again, and it's quite clear that although we now have new platforms that enable quite fast design of vaccines, the manufacture of them is something else again, and we certainly have been caught short in terms of our ability around the world to produce the vaccines, even once they're licensed for use.
More domestically then, let's also talk about, if we may, the rise in COVID cases of the Delta variant here. Yesterday we heard, didn't we, they'd gone up in every region across England, and it's spreading fastest among 20 to 29-year-olds. So what are your concerns over that as we head to that final unlocking date of the 21st of June? Labour, for example, saying delay it and support businesses affected instead.
Sure. I mean, all modelling, and most of us expected cases to rise after May the 17th. That was the last roadmap easing that we've had, because that of course that allowed the more high risk contacts, so indoor hospitality and mixing of households inside, and that's exactly what we've seen. So I think this rise is both driven by the Delta variant that is clearly more transmissible, as well as the easing of restrictions. So I think at the moment we're going to see cases continue to rise, but of course what we're all waiting to see is the effect that has on disease itself. Vaccinations have clearly helped to break that link. I guess there's still some uncertainty about how many of these younger age groups who are really where the infection is happening might end up in hospital, but it's quite clear that they're less sick than if they're it was older people getting infected at the moment, and their hospital stay is shorter. So whilst I think a delay of a couple of weeks would enable more people to be vaccinated and a bit more data, I'm not entirely clear what a delay of a couple of weeks was going to achieve. If you take that policy through to its end, you wait until every single adult who's eligible for the vaccine has had both doses, which provides the full protection. And that's not a couple of weeks, that's a few months. So, maybe we're reaching the point where we have to be brave and say, look, we're doing absolutely everything we can in terms of providing the protection, which is through vaccination. whatever happens beyond that is so-called the new normal, learning to live with this virus, and we have to accept those consequences, because they're not going to be as bad as anywhere near as bad as last year.
Professor, really good to speak with you this morning and get your perspective. Thank you for joining us live here on LBC News. Professor Andrew Preston there, reader in the Department of Biology and Biochemistry at the University of Bath. Labour says
were being made.
Where the news never stops. LBC News.
Also in our main headlines here on LBC News this Tuesday morning, there's a warning health and social care staff burnout has reached an emergency level. A cross-party government report says the problem won't be solved without what they're calling a total overhaul of the way the NHS manages its workforce. It says that although the issue may not be solved overnight, workers should be reassured that a long-term solution is in place. Well, joining me now for more on that is Professor Martin Green, Chief Executive of Care England. Good morning to you, Professor.
Good morning, Lisa.
Now, have I got this right? I gather you gave evidence to that cross-party committee of MPs.
Yes, I did. And we are all concerned, I think, about the toll that the COVID pandemic has taken on our staff. And I have to say, both the social care staff and health staff have been absolutely magnificent throughout this really serious crisis. But I think we should acknowledge that it has put an enormous pressure on them. And we've got to have some long-term strategy which enables them to be supported and also looks to their well-being.
And no doubt you told the MPs all of that. The fact then that they're struggling now to this emergency level, that's the quote, is that all down though to coping with the COVID crisis and that they've probably had very few sort of holidays or breaks away from all of the stress?
Yeah, I think that has been part of the challenge. And certainly in social care, we saw people who had to move into services at the start of this pandemic and were disconnected from their families for a long time. So, that was another added pressure. But it really showed the huge commitment that staff have got to the people they support. And we have got to find some way to think about how we manage and support them as we're coming out of the pandemic. But I also think, Lisa, we should be looking, particularly in social care, at a long-term strategy for the workforce. The chair of the Health Select Committee, Jeremy Hunt, has called for a 10-year strategy in social care that would mirror the 10-year strategy in the NHS. So I think we've got to use what's happened, first of all, to acknowledge the fantastic contribution of the staff, but secondly, to say to them, this will be the platform for real long-term change in the way we support you.
From your findings, have you found firm evidence that care staff have actually left their roles entirely because of burnout? Many perhaps taking early retirement, many perhaps choosing just to do other jobs?
Yeah, we have seen some of that. And I think also we should acknowledge that we're still in the midst of this pandemic. And as the pandemic starts to dissipate and we start to come out of it, I think that's the moment we'll see people thinking, well, do I want to do this in the long term? Have I got the energy left? So I think there have been a few cases of people exiting the services, but I don't think we've seen the end of that. And I think also, particularly in the care home sector, we might see people who have been in the care home sector for a long time feeling that this was the final straw.
Chair of the BMA Junior Doctors Society, for example, has said the NHS needs extra staff, more funding, realistic workforce planning and investment too for health and well-being initiatives. Now, you made that point earlier, but what would that perhaps look like in reality? What would you like to see happen?
Well, the first thing to say is the NHS has those challenges, but they're not nearly as bad in the NHS as they are in social care. So I think one of the things we've got to do is we've got to see the health and social care system as a much more integrated system, and the workforce issues need to be across both health and social care. I think what I'd like to see, for example, more opportunities for staff to have time to reflect on their practice. I think I want to see some access to counselling and support where it might be needed. I want to see also higher levels of staffing so that people are not so pressurised. I think we need to have an emergency strategy, and we'll have learned a lot from this pandemic, but it might not be the last pandemic, sadly. So I think we need to have a much clearer strategy going forward about how we would manage a similar situation into the future. And then in the long term, we need to have much more clarity about social care careers, and we need to pay people what they're worth. And I I think this pandemic has really shown that in the social care sector, the staff have been absolutely fantastic, and we owe it to them to find some way of making sure that they're seen as professionals, they're paid and trained in that way.
Just finally, post-Queen's speech, many people came forward to say, you know, there's a definite reluctance from this government towards social care policy and strategy. What do you think? Why do you think that might be?
Well, I have to say it's not just this government. We have been failed by 5 prime ministers going back to Tony Blair. Every single one of them has promised us social care reform, and every single one of them has failed us. Now, I hope that this prime minister, who did actually put social care reform in the Queen's speech, will do something that the others haven't, which is give us a long-term view about how social care will be funded and how the workforce will be supported. And so what we need is a system that is funded and appropriate for the 21st century. And this Prime Minister has his opportunity to have a 1948 moment and to transform social care. And I hope that he won't be found wanting.
Professor, really good to speak with you this morning and get your perspective. Thank you for joining us live here on LBC News. Professor Martin Green there, Chief Executive of Care England. Still ahead this morning.